Hi everyone, I'm Julian. I'm from the Department of Neurosurgery in NNI, our National Neuroscience Institute. Thank you for taking the time to listen to this talk on brain aneurysms. This is not that common a disease compared to other problems like cancer or heart attack, but to me and my team here in NNI, we deal with brain aneurysms almost on a daily basis, about 1 to 3 cases per week. So let me take this opportunity to share more about this topic. As we go along, please note any questions you may have and we can address them during the Q&A session at the end. Okay, let's get started. So, what is a brain aneurysm? We use words like bulge, bubble, balloon to describe an aneurysm of a brain blood vessel. It usually occurs where a blood vessel splits into two. It is an area of turbulent blood flow. It causes that area of the blood vessel to be weak. It then forms a bulge and it can grow. This animation shows how brain aneurysms can form and grow, and if it grows large enough, it can rupture, causing a bleeding stroke. For the rest of this talk, I'll be using a small blinking blue ball to indicate where the aneurysm is. You can see that to help illustrate some examples. So, every aneurysm is different. They come in different shapes and sizes. They can be in different locations and can have different characteristics, and some are harder to treat than others. But just for this talk, I'll just focus on the most common shape, the one that is shaped like this one over here, like a small bubble in the top left-hand corner. Okay. So, who does it affect? This is a paper that our department published back in 2017, where we investigated how frequent we find brain aneurysms on brain scans done for various reasons. We looked at 4,572 MRI brain scans done in 1 year, and we found that 1 in 30 of these scans, we detected a brain aneurysm. So that would put it at about 3.5 chance that any of us would have a brain aneurysm. The worldwide statistics is about 1 to 5%, so we're somewhere in the middle. And in our population, in terms of the female to male ratio, it is about 2:1. The worldwide ratio is about 3:2 to 2:1. So in general, females are a little bit more likely to be affected with a brain aneurysm. In terms of what ages does it affect, it's usually between ages of 30 to 70. There can be older ones as well, but it is rare in children. Okay, so what are some of the factors associated with brain aneurysms? There are some factors we cannot change. For example, genetics, female sex, older age, but there are also other factors that we can change or control. For example, smoking and high blood pressure. We routinely recommend patients to stop smoking and to control blood pressure, as these are known associations with brain aneurysms and aneurysm rupture. There are some reports linking chronic heavy alcohol intake and stress with brain aneurysms, but that association is not as well established as smoking and high blood pressure. Okay, so in terms of what medical conditions are associated with brain aneurysms, well, there are many associated conditions, but the most common association is polycystic kidney disease, in which 8 to 12% of these patients have a brain aneurysm. In the Department of Neurosurgery, we routinely get referrals from kidney doctors to help screen these patients for brain aneurysms. Okay, a polycystic kidney looks like that, where there are many bubbles compared to a normal kidney. Okay, so how are brain aneurysms detected? Most commonly, it is an incidental finding. Brain scans are done commonly for many reasons. For example, headaches, giddiness, after you fall and hit your head, etc. So you accidentally detect them. These incidental aneurysms are usually small and very rarely cause symptoms. Usually you just need monitoring with scans. Okay. But if it does cause symptoms, what are some of these symptoms? Okay. They may grow big and press on nearby structures. For example, this one. Okay, if you look at this, now you recognize where the aneurysm is. It's a blinking blue ball over there. And right next to it is this nerve called the third nerve. So if the aneurysm grows and it presses on this third nerve of the brain, it can cause things like blurred vision, double vision, or a droopy eyelid. And if it grows big enough, it can rupture and it can cause what we call a hemorrhagic stroke, a bleeding type of stroke. Okay, so when an aneurysm ruptures, it is a medical emergency. But how do you suspect that an aneurysm has ruptured? Usually, patients will say they had a very sudden onset severe headache. They will say that it is the most severe pain, 10 out of 10. They can say things like they had a thunderclap sensation in the head. They will also say things like, this is not my usual migraine. They can have things like nausea, vomiting, and you can also have stroke-like symptoms. For example, if you're weak on one side, a droopy side of the face, the patient can go into some drowsiness and potentially even fall into a coma. And when you suspect something is not right, please call 995 as soon as possible. So time is of the essence in such situations. And when the patient arrives in the hospital, we will get an urgent CT scan. That will show bleeding in the brain due to an aneurysm rupture. On a CT scan, blood is white in color. Look at that. These cases are usually managed in the ICU, and sometimes emergency surgery needs to be done. For example, we may need to insert a tube to drain blood or fluid accumulating in the brain, or we may need open brain surgery to remove a large blood clot pressing on the brain. And if these are not done in a timely manner, the patient may lose his life. Our next step then is to prevent a repeat rupture of this aneurysm, because if it ruptures again, it will very likely be deadly. We need to get rid of this weak spot that may bleed again. So to do that, there are two possible options. The first way is microsurgical clipping, which is to physically close off the bubble with a clip on the outside of the bubble. The second way is endovascular coiling, which is to fill the bubble with coils from within the blood vessel. One is not better than the other. It is assessed on a case-by-case basis, and it really depends on the aneurysm and the patient. Most times, one is more suited than the other, and we will make the necessary recommendation. Okay, let me try to explain the procedures. Microsurgical clipping is open brain surgery. This involves using a drill to make an opening in the skull, after which we will open the soft covering of the brain to expose the brain. And under a microscope, we will find the aneurysm within the brain and place a clip on it to close it off. This is usually the most challenging part, looking for an aneurysm that is less than 10 millimeters, less than 1 cm in an angry, swollen brain. Okay, so this is microsurgical clipping. Okay, so this is a case we did recently. You can probably now recognize where the aneurysm is. See that blinking blue bubble again. Again, it's at a branching point of a blood vessel in the brain. And in this case, it wasn't that big. Coiling was going to be difficult for this case and probably more risky for this particular aneurysm. So I decided to clip it, which was probably safer for this patient. Okay, and so this is the post-operative scan. You can now see where the clip is in green, and the aneurysm is now closed off. Okay. The other way of treating aneurysms is from within the blood vessel, what we call endovascular. This literally means inside blood vessel. This method is minimally invasive, and we can achieve a similar result of getting rid of the aneurysm. Okay. We will enter the blood vessel in the groin with small tubes and wires. Okay. And then we go up the main big blood vessel of the body. And then we will go up the blood vessel in the neck. And finally into the small blood vessel of the brain, which can then measure about 2 to 3 millimeters. This is done with advanced imaging to give us a roadmap to the aneurysm. You may wonder why we enter from the groin just to get all the way up to the brain. We usually enter from here as it is a vessel we can enter easily as it is close to the skin surface, and it provides a straight path upwards to the head. Entering from the blood vessel in the wrist requires us to make a U-turn upwards to the head, and this is not easy to do. So we usually enter from the groin. Okay, and now that we are in the brain and close to the aneurysm, okay, now you can see where the aneurysm is, the blinking blue ball again. We can now take good detailed pictures of the aneurysm. Okay, so this is a very detailed, clear picture of the aneurysm. And with these small tubes and wires, we can start filling the aneurysm with coils. Okay, you can look at this video. Okay, I'm pushing a long coil wire into the aneurysm to fill it up as much as possible. Okay. And finally, the aneurysm will be completely filled with coils, which will block blood flow into the aneurysm, and thus it cannot rupture again. So there are many tools that we can use. You've heard about clips, you've heard about coils. We can also use things like small balloons and small stents to hold the coils to stay within the aneurysm. And there's also a new type of stent called a flow diverting stent. This stent diverts blood away from the aneurysm, and the aneurysm will dry up. We will decide which tool or tools to use based on different characteristics of different aneurysms to be as safe as possible to achieve the best outcome for every patient. And sometimes we need to be creative. So I'm going to share this interesting case. Okay. So this is a patient's neck, and this is his brain, and those black squiggly things are blood vessels. And this is the main blood vessel from his neck to the brain. Okay. And you can see that there is a very large aneurysm of this main blood vessel. Look at that. It's blinking again. In order to get rid of this particular aneurysm, we would have to get rid of this main blood vessel too, which would then cause a stroke, as the blood vessel to the brain will be cut off. Therefore, we need to create an alternate pathway for blood to flow from the neck into the brain before we kill the aneurysm. And so this is what we did, a bypass surgery. Okay, you can see that there are two pathways into the brain now. Okay, so now blood is now flowing through that alternate pathway to the brain, and now we can get rid of the aneurysm with coils, along with that main blood vessel, and patient is okay. Okay, there could also be other potential related problems, for example, seizures, also known as fits, for which we can give seizure medications. There could also be brain fluid accumulation, for which we may need to do surgery to place a permanent tube from the brain into the abdominal cavity to drain this excess brain fluid. Or there could be vasospasm, which is the narrowing of blood vessels, which I will talk about in the next slide. And if there's significant stress to the heart and lungs, there could be cardiorespiratory failure, which could be fatal. So, what is vasospasm? It literally means blood vessel narrowing. And if it's narrowed enough, there may not be enough blood to the brain, which can cause a stroke. What we can then do is to use, again, catheters, medications, balloons to help open up the narrowing to help prevent the stroke. An aneurysm rupture could be a very stormy affair, but once all the issues have resolved, the rest of the journey is really about neurorehabilitation, which is key. It usually takes many months, up to 1 to 2 years, requires a lot of persistence, a lot of patience, and a lot of dedication, and family support is paramount. Maybe I can share an inspirational story of a patient of mine, Miss Dominic Low. In August 2020, so that would be about 4 years ago, she had a ruptured brain aneurysm, and she was admitted to Tan Tock Seng Hospital with a very severe headache, and she fainted. I had to do open brain surgery clipping for her as her aneurysm was not favorable for coiling. In fact, she had 2 aneurysms side by side, and both were clipped in the same surgery. But that wasn't a problem. Surgery was okay. 1 week later, she suffered from a stroke due to severe blood vessel narrowing, which I described just a couple of slides back. We had to bring her down to inject medications into her brain with the small tubes using the endovascular method, but the stroke had already happened. We just managed to prevent it from getting worse. And subsequently, she had difficulty walking and had speech difficulties. She had to relearn a lot of basic things. She underwent intensive rehabilitation, and with a lot of patience, determinations, and help from her partner, she is mostly back to normal now. But that really took a couple of years of hard work. There are also some famous people we may know who also suffered from a ruptured brain aneurysm. This is Emilia Clarke from Game of Thrones. So she suffered from 2 different aneurysms. And this is the US President Joe Biden. So I think it was quite a long time ago, maybe 30 years ago, that he also suffered from a ruptured brain aneurysm. They both shared similar stories of excruciating head pain when the aneurysm ruptured. They fell unconscious, they underwent emergency surgeries, coiling or clipping, as I previously described. But the main message from them was that there was timely diagnosis and timely intervention, such that they managed to recover well from it. Similar to their stories as well, somewhere closer at home, our DPM Heng Swee Kiat also suffered from a ruptured brain aneurysm in 2016 and was treated here in NNI. And again, because of timely diagnosis and intervention, the necessary were done, and he too has made a reasonable good recovery. So, what are the statistics of a ruptured brain aneurysm? Well, the facts are half of the patients with a ruptured brain aneurysm will likely pass away. Of those who survive, slightly more than half will have a permanent neurological deficit, and slightly less than half will be mostly okay, usually because of timely intervention. And time is brain. Getting to the hospital early can help reduce brain injury. So, an accurate early diagnosis is critical. I'm just going to put up this slide again. If there is any take-home message for today, this is probably it. Recognize an aneurysm rupture and call 995 as soon as possible. We have been discussing about ruptured aneurysms, right? But actually, we see more unruptured brain aneurysms than ruptured ones. The question is, should we treat an unruptured aneurysm? I think that is a golden question. Most do not require treatment, but the difficulty is to identify the ones which need to be treated. If there are published scores to help us make this decision, the higher the score, the higher the risk of rupture, and we may recommend treatment if the risk of rupture is higher than accepted. Each and every case is different. There are also published scores that can help to predict if an aneurysm will grow. And again, the higher the score, the higher the likelihood it will grow larger in the next few years. And if it grows, we will normally recommend treatment, especially if it looks irregular. Okay, so we decide based a lot on the aneurysm itself, like its location, where it's located, its size, how big it is. The bigger it is, more likely that we'll treat. Whether there are irregularities like a small nipple, which means that that area is probably likely to rupture, and whether it's growing. But ultimately, it is not just a science, but it is also an art. And it's also talking to the patient and understanding the patient. Every patient and aneurysm is different. So, if one is diagnosed with a brain aneurysm, it will be good to have a review by a neurovascular specialist. A neurovascular specialist is a specialist dealing with blood vessel problems of the brain and the spine. It usually involves a multidisciplinary team involving neurosurgeons, neuroradiologists, and neurologists. You may need further dedicated specialized imaging to help understand the aneurysm better. For example, the angiograms that we saw earlier. And there will be a comprehensive risk assessment to help you make a decision. So, is there a need for screening to look for an aneurysm? Well, usually I wouldn't recommend screening, but in cases where there is a strong family history of brain aneurysms, then definitely yes. Or if you have polycystic kidney disease, which is a known major association. Okay, so key takeaways for today. I think we should be able to recognize symptoms of a growing aneurysm or brain aneurysm rupture. And if you do suspect something is wrong, call 995 as soon as possible. And how do we reduce risk? Don't smoke and control high blood pressure. And also know that not all aneurysms need to be treated. Most just needs monitoring. And ultimately, I think a personal risk assessment is needed. Okay. Thank you all for joining us today. Your health is important, and understanding aneurysms can save lives. We hope this session has provided valuable insights into recognizing symptoms, understanding risk factors, and exploring treatment options for brain aneurysms. Remember, early detection and awareness can make a significant difference in outcomes. As we conclude, I encourage you to stay informed, share what you have learned today with your loved ones, and together we can raise awareness of brain aneurysms.